Questions and responses for chiropractic care. Question 1 from Carol Hill. I've been getting chiropractic care for the last 4 years. My pain got worse over time. My scoliosis Cobb angle went to greater than 100. What went wrong? Carol, this is super, super common. See, when you're looking, you need an objective analysis. This means they've got to take an x-ray, they got to take another x-ray, but also nerve scans, thermography, any other objective analysis. Blood cell analysis would be good. But if you're only adjusting, you're addressing the physical stressors. You've got physical, chemical, and emotional stressors. All three affect the body in the same way. So if they gave you the exercises and adjustments to correct the physical stressors, and they gave you exercises throughout the day to restore the curves, because the biggest thing in scoliosis is the lateral deviation. That's what a scoliosis is. But to restore the front to back curves is the key. So every time you're sitting, every time you're driving, those exercises are vital. Beautiful physical stressor. Chemical stress and stabilizing the pelvis, because you figure scoliosis, people have ligaments 2.5 times more flexible than the average. So you have to stabilize some joints and mobilize and change that neurology with other joints. Next, you've got to clean up the gut. You've got to get the right nutrients, and you've got to change the sleep patterns. Those are chemical stressors. And look at the medication use, because every medication slows or stops a metabolic process. And that can be damaging when you're creating inflammation to regenerate. The way that you do an appropriate adjustment is you're creating inflammation, hopefully at the level of the disc, so the body can regenerate. And that's vital. But if you're not addressing the chemical assault from toxic food or medications, if you're not addressing the poor sleep patterns, that's going to be a big contributing factor, because sleep is when your body regenerates. And this is why we teach sleep restrictive therapy to every patient. And then emotional stressors. Think of that cat, the Halloween cat, their back fires off. Emotions are chemicals secreted by their brain on how your brain perceives the environment, not what's actually happening. And so this way, and you've got this automatic nervous system. One switch, you're in stress and survival. The other switch, you're in regeneration, sympathetic and parasympathetic. That regeneration occurs mainly at night. That's why, obviously, sleep is going to be important. And I'm talking deep restorative sleep. The other aspect of that is emotions. And you can think yourself healthy and think yourself sick. And that's kind of true and kind of not true. I know you've heard that before, but if you're in a stress state, and this is physical, chemical, emotional stress, your tissue production is reduced, or that parasympathetic is reduced. Just think of those guys that meditate, Om, they can raise or lower their blood pressure. Om, they can do crazy physical things like holding their breath for long periods of time. So if you master your emotions, you change your physiology. And one of the brilliant doctors now is Dr. Joe Dispenza, and I encourage you to read the book, Becoming Supernatural. Brilliant book. But just know that if you're mastering your emotions, you change your physiology. And we're looking at anxiety, stress, depression, impulse control, schizophrenia, bipolar. Those are all features of the frontal lobe. And luckily, the frontal lobe is programmable. But then also that brain function is a direct result of what's going on with the gut. It's called the gut brain or enteric brain. So you've got to look at all the contributing factors, because you cannot just get an adjustment and that only takes 5-10 minutes, and then the other 23 hours that you're doing throughout the day, you're not you're either not regenerating or keeping in a stress state, or not doing things that facilitate it. This is why when every patient, we recommend a juice to clean the arteries. We recommend live blood cell analysis, so we could see if the cells are stressed, which means they're overlapping and they can't hold the oxygen. So all of these things you've got to monitor and measure. So this way you can tell, yes, your body is in a balanced autonomic nervous system state, and your body is poised for regeneration. And more chiropractors need to address this. And this is why I've been teaching chiropractors for decades, but the schools are dropping the ball in that respect. Luckily, I was taught by masters. that knew that we're working with magic. And if you're addressing the physical, chemical, and emotional stressors, then bodies have the best chance to regenerate. Please like this video, subscribe to my channel, and comment below. And also share this vital life-saving information. And we can literally change the world together. Share it with your family and friends. Let's change the world together. Question 2 from Paula Micolo. My sister and I have been going to a network spinal analysis chiropractor for at least 10 years. I love going, but my sister has developed trigeminal neuralgia. Any suggestions for her? She's gone through food elimination, gluten-free, no almonds, and is now dairy-free, and has helped using essential oils. The reason I met one network chiropractor who came up from Australia, brilliant guy, but he did it a little bit different. He would do pre and post X-rays, and he also did additional adjustment. Network analysis is great because you're working a lot with the emotion. But if the chiropractor is not doing an objective analysis like pre and post X-rays and showing an objective analysis that you actually are restoring the curves, eliminating any lateral deviation, then the chiropractor is missing it. And that's okay. And when you look at it, corrective chiropractor or general chiropractor, the regular chiropractor is like going to a regular dentist. Fantastic. They can do a good cleaning. They take care of the health of the teeth. They're fantastic. That's a general chiropractor. And you're looking mainly for symptoms and making the patient feel good. Everything's good about that. A corrective chiropractor is like going to the orthodontist. Okay. This is a guy that's focused in on correcting, and he's going to be addressing the physical, chemical, and emotional stressors. So the body has the maximum ability to regenerate. So this requires objective analysis of pre and post X-rays, pre and post nerve scans, pre and post blood analysis, whatever criteria you're doing, but have an object that you can measure. And that's the difference between feeling good, making sure bodies function optimally, which is what all chiropractic care is designed, unless they're in the medical model where they're doing certain therapies to eliminate certain symptoms. Just know that all symptoms are alarms to tell you that there's something wrong. Like back pain, I've never seen back pain just regards to the back. There's always going to be secondary and tertiary contributing factors. So, and then the food elimination, that drives me nuts. Okay, because we've got an automatic nervous system. One part keeps you alive under stress. The other part regenerates tissue, sympathetic, parasympathetic. When you're in a chronic state of stress, you have decreased blood supply to the gut. So if you're doing a food elimination diet now, and these were foods that you tolerated very, very well 5 years, 10 years, 20 years, 30 years earlier, and now you're having an issue with, well, guess what? It's not the food. It may be the food if the food was organic 20, 30 years ago, and now it's full of preservatives, toxins, or, other ingredients that weren't in the food system 30 or 40 years ago. And then your body's going to have an reaction or inflammatory reaction to those new ingredients. That's one. The other is if you're in a chronic state of stress, you're going to have decreased blood supply to the gut, where proteins that aren't tempered by digestion can get in the bloodstream, and this can trigger an inflammatory response. So look at the leaky gut as the biggest thing. Forget the whole, food elimination is cool, but look at a leaky gut as the biggest contributing factor. And what causes that leaky gut? It's a sympathetic dominant or stress state. And so then you've got to rebuild that intestinal tract, but get out of that stress state first. Because like if I go in and I step on your foot, bam, your heart rate's going to go up because you're in stress. Blood supply to the gut's going to shut down. So even though the chiropractor is addressing certain emotional issues, hopefully they're addressing some structural issues as well. Hopefully the chiropractor is using an objective analysis of X-rays, like that chiropractor that came up from Australia. Brilliant guy. I wish I could remember his name. It was like 10 years ago he came up. So if they're doing that, beautiful, then how are they progressing on the physical? But also address the sleep patterns. Look at juicing and blending. Look at moist heat on the tummy to start rushing blood to that gut area. And the gut is under parasympathetic nervous system control. So this will all help get blood to that area and start healing the gut. And then slowly reintroduce these foods as long as you're correcting the sleep patterns, you're correcting the physical stressor, and you're mastering the emotional stressor. This is why we teach heart math breathing, we teach diaphragmatic breathing, we teach neurolinguistic programming. Every patient gets at least 3 different methods to deal effectively with the emotional stressors. And you have to address it. We're on a 3-legged stool: physical, chemical, emotional. And the essential oils are great, but no one's suffering from essential oil deficiency. Food elimination diets are great to allow you to plug the holes in the dam of that intestinal tract. And let me know how you're doing, Paula. Question 3 from Julia Gumma. I have difficulty in closing my hand completely, the stiffness in the first and second knuckles. I'm trying to clench my fists. A coin can drop through it. It can be challenging to try and pick things up. Years ago, doctor took an x-ray, said it was arthritis, and exercises would be no good for it. Yeah, we got to fire that doctor. I'm 78 and basically have no other issues with arthritis. Do you have any suggestions? Thanks for the time to share your wealth of information. You're the best. Julia, you're the best. Honest to God, you're the angel. I'm just a wrench. Okay. Now, when we look at this, arthritis, what is arthritis? The most common is osteoarthritis, and that's from a trauma. Now, you are not going to have hand arthritis unless you have a problem with the neck. And the doctor saying that exercises will not be good for it is completely wrong. What you're going to have with the hand dysfunction, when we take an x-ray of the neck, and you're going to see loss of curve, forward head carriage, or the head's off to the side. So this means blood supply and nerve supply are going to be compromised to the hand. Right now, if you put moist heat, so, check your hand to see how it opens and closes, get a damp cloth in the microwave, moist heat, or, heat up some hot water on the stove. Don't burn your hand, but wrap it in a moist towel. Count to about 2 minutes. Okay. So you get a lot of, because when you put heat on an area and take it away, what color is that area? It's red. And that red means that the brain senses that difference in temperature and increases the blood flow to equalize the temperature. So you're artificially increasing the blood supply to that area. And since every joint is hydraulic, you're instantly going to notice more movement because you've filled up the space and now the joint can move. I mean, we're just talking basic common sense. And with your head forward, you're choking off, it's called thoracic outlet syndrome. You're choking off the blood supply and nerve supply to that area. So that's just a parlor trick. That's not, you could use it to help get more blood supply to it so you can do some of the exercises. But the key is to find a corrective chiropractor that's going to, or a good chiropractor that's going to take an x-ray, identify the problem, take another couple of x-rays to show that they're correcting the problem. And then you can work on wrist extension issues. You can work on just working in those joints and look at our carpal tunnel videos, look at our rotator cuff and shoulder health videos, look at our pelvic videos, because you are not going to have a neck and a hand symptom without having a pelvis or lumbar. Don't let symptoms guide your care. Okay, but 90% of the nerves coming off the spine, there's no pain fibers. So have somebody do an objective analysis from the pelvis to the nose. I would say the nose to the toes, because you've got to find out to make sure that that entire structure is functioning correctly. Because if there's a deviation in that structure, you've got this automatic nervous system. One part keeps you alive under stress. The other part regenerates tissue. If you're in a stress state, you're not regenerating. Also, look at the nutrition. Make sure you're up to 2 to 3 healthy bowel movements a day. Look at your sleep patterns. That's going to be huge. And look at the emotional component, because dear, at 78, you should be playing tennis. You should be doing a lot of things, not worried about your hands opening and closing. And if there's movement in the joint, that joint can start to regenerate. Just had a patient, and actually this week she was super excited when she came into me and started care. And we're talking 3 weeks ago. The pinky was bent over to the side. Okay. And it was from a trauma she had. She's in her late 30s, early 40s now. And she broke her finger, but it was not the bone he distorted. It was the joint that was distorted. So over the last 3 weeks, I'm adjusting the neck, restoring the muscle balance of the forearm. And I told her, just keep working that tissue, working that tissue, working that tissue. to distract it and pull it back in place. And now she went, look at my hands, they're all straight. And it's so wild for doctors to not understand that your body is alive. Those joints are alive. If they are alive, everything in there, the cartilage, bones, ligaments, everything has to take in nutrients, produce proteins, and eliminate waste products. And if they produce the appropriate proteins like cartilage, ligaments, bone, everything can change. But you got to create inflammation at that joint and so cause that little bit of an irritant, and then the joints can regenerate. God bless you, my dear. Let me know how you're doing. Question 4 from Tone Ranger. I like the name. You've responded to me once before. I still have neck issues, stiff muscles that give me occipital headaches and random dizziness. I have several gadgets to help. Pettibon Traction and neck pillows. Not 100% yet, but fighting every day. For me, Pettibon works better than the posture pump. I overdid the pump and it gave me vertigo. Seems like my neck curve has been gone for so long and it doesn't want to return. I like the way you put that. Diagnosed type 2 diabetes last year. It took me 3 months to get my glucose normalized, but I still spike from time to time. My doctor wants me to do a sleep study, but I can't fork out the $3,000 right now before Christmas, one thing after another. Okay, Tone Ranger, let's get you healthy. So one of the things, I'm totally with you. I worked with Dr. Graham, the developer, the inventor of the posture pump for 9 years. He is one of the most brilliant, nice guys you've ever wanted to meet. Okay, now we give out the posture pump a lot. I do not give it until we get the first post x-ray. And that first post x-ray has got to show the curve in the neck coming back or starting to restore. We have to show that there's increase in disc height. The first x-ray identifies a problem. Second x-ray we do after 30 adjustments. And so if we are seeing it, then we try them on the posture pump. we don't just randomly give it to everybody because it is very powerful. So I'm with you. Pettibon, I like a lot of the things that they do. I do not like the head weights. I like a lot of the exercises that they do. We use Pettibon x-ray marking for our x-rays. So we've got to get you to a good chiropractor that's going to take a set of x-rays. Now, with your a neck curve that's been gone for so long and it doesn't want to return. The way that I would recommend is you take a static x-ray, then you take an x-ray and force that neck up as high as you can, then take another x-ray. Then you can tell if the joints are moving, the neck can return. If the joints are fused, the neck curve can't. And then if it's fused, because I work on a lot of post-surgery patients where, man, if you fuse a neck, and you got steel rods in there, you're not going to restore the curve. But you can de-stress this out by restoring the lumbar curve or increasing the kyphosis or decreasing the kyphosis or of the thoracic area. So there's a lot of things you can do if it's not moving, but I would like to see a stress x-ray to show it is moving. Okay, that would be like ideal. And then get a series of adjustments. When you start to get mobility in the neck, then everything. The dental roll is really, really good. Idealspine.com is a great place to get those. A posture pump, a lot of the Pettibon exercises, but you've got to get a good analysis from a good chiropractor. Type 2 diabetes doesn't exist. It's blood poisoning in a stress state. That's why it took you 3 months to get over it. I usually tell people blood sugar will normalize in about a week to 2 weeks, and it takes about a month to get over it. But we're changing the sleep patterns. We're changing the physical stressor. Talk about breathing all the time. Give them breathing exercises, diaphragmatic and heart math breathing, and the neurolinguistic programming, and to reprogram the emotional components. So if you're addressing the physical, chemical, emotional stressors, you're going to see a very fast result on type 2 diabetes. Do not fork out the $3,000 for the sleep study. Assume that you do have a sleep problem. And what's the solution going to be? Buddy, check out our sleep restriction videos. Very easy to reset your circadian rhythm. And just know that you go through these 90-minute cycles called rapid eye movement, where you're in a coma. This is where most of your energy goes to regenerate the tissue. When you complete that 90-minute cycle, your eyes open, then they close. And if there's enough light to see your hand in front of your face, this is where you're getting up every 90 minutes or every 2 hours to pee or roll over, and you wake up not refreshed. So in the sleep restricting videos, you're going to learn about nightshades, about preparing your mind before sleep. You're going to learn about the sleep environment. You're going to learn about what sleeping too much and too little is. So just check out that research and save the $3,000. And let me know how you're doing. But absolutely, the stiff muscles giving you the occipital headaches and random dizziness, this indicates a structural issue. Absolutely. Because those muscles that run down from the occipit all the way down to the sacrum, they're not under conscious control. They're only under proprioceptive and nerve control. So that is the biggest clue that you're missing a curve in the neck. We just got to see if you can get it back. And let me know how you're doing, Tone Ranger. Question 5 from Regenerative Agriculture. Oh my God, I love the name. I'm into it. You're the only chiropractor that makes sense. God bless you. Can't seem to find one like you. And I keep trying to find one here in Utah, end up firing them because they say things like your spine was not meant to twist. What kind of nonsense are they spreading around? Amen. I keep searching, but then I just have to say to myself, I need to go back and see Dr. Bergman because he's brilliant and has God-given gift to understand the body. You're still the best chiropractor around. Regenerative Agriculture, God bless you for your comments, and I totally understand your frustration. I was taught by masters, and these guys, they were chiropractors before chiropractic was approved by insurance, where you're approved by insurance, but you can only work on back pain or neck pain. Okay, no, these guys were doctors of the autonomic nervous system. They would work on autoimmune conditions, all sorts of chronic diseases, and see recoveries. Why? Because the body uses this nervous system control and coordinate every function of the body. It controls hormone level. It controls your tissue regeneration, literally controls how your body regenerates. And that is not taught in schools nowadays. It's go along to get along. So 86% of the schools in the country, chiropractic colleges, are no longer teaching traditional vitalism chiropractic. And it's a shame because it will not be a lost art. This is it's not going to be like the pyramids. We're going to know how the body works. This is why I'm doing thousands of videos. And this is why I'm at the clinic in Bangkok now. And and Monday I'll be at the clinic in Huntington Beach. Thursday of next week, I'm going to be in the clinic in Mexico. So I'm trying to do as much as I can to spread the vitalistic viewpoint that the body is self-healing and self-regulating. And I love when they say things, the spine was not meant to twist. Oh gosh. It's like saying don't bend and turn while you lift. And the joke I make about that is, okay, 2,000 years ago, you and me are hunting. You make a beautiful spear shot on an ibex. And I say, now be careful, don't turn and twist while you lift. No, that's stupid. No, the body is designed to have movement. We've got a really mobile lumbar on top of it with a really immobile rib cage sitting on top of that, with a super mobile neck on top of that. We are designed to bend, turn, twist, and move. And in fact, movement gives nutrients to those joints. And remember, chiropractors do not heal anything. What a chiropractor does, and this is why they have that arrogance and ignorance in medical schools and chiropractic college. There's some doctors that are produced that have a humility and understand the brilliance that is the human body, that the body is self-healing and the body is self-regulating. All of these are facts. What a chiropractor does is remove the interference to allow the body to regenerate and make healthy tissue. One of the founding members, B.J. Palmer, in modern chiropractics, even Hippocrates said when confronted with disease, first look to the spine. He said, chiropractors work with the subtle substance of the soul that emanates from the brain down through the nervous system to animate and give tissue life. Chiropractors remove that interference. I mean, it's probably a really bad quote, and my kids always give me crap for giving wrong movie quotes, but it's pretty darn close. When doctors understand human beings are magical, they're angels, they're made of divine energy, they're made in the image and likeness of God, then the job of a chiropractor is to release that imprisoned impulse so the body can adapt correctly. God bless you and take care, my friend. Now, if your question wasn't answered in this video, please visit the Dr. P VIP site because there I can respond to the rest of the questions. So God bless you, and please share this video, share this vital information. Let's change the world together.